Let me just walk you through what might happen if someone had a migraine. Someone's at work, they're not functioning, their head's on the table, they're really in distress. You simply start with these words. Point to where it hurts. They always know where it hurts. Sometimes it's here, or it's right behind this eye, or it's wherever it is, doesn't really matter. First thing you're going to do is find the location. Second thing you're going to do is you're going to find the color. These are really important things. Then you're going to move it. Now sometimes it's hard for them to move it. And if that's the case, I'll sometimes have them shrink the size of the color a little bit before we can move it. But usually I'll just move it from where it is to the outside of the head. And then the next step will usually be I'll move it to the other side of the head or on top of the head. At which point we're going to go through a couple of additional things. We're going to change its size. We're going to change its color. We're going to change its rotation. Now frequently they don't think that it has a rotation, and so I always start by saying, notice that it has a rotation, and they will notice suddenly that it is rotating, because we're going to reverse the rotation. Sometimes that is the most powerful modality in getting a shift. But by doing that, we can get it to move any place we want. Sometimes you can move it, have it reside in someone's finger. Sometimes we're going to do something that's even more dramatic. If this is a really exciting or dramatic problem, we might go to the next step. And the next step would be, we're now going to have them reduce that pain to the size of a ball to where they can, in their mind's eye, hold it in front of them in cupped hands. So imagine that it's in front of you in cupped hands. Then I'm going to say, we're going to do all of these things at the same time. Don't start yet. Then I'm going to instruct them that we're going to reverse the direction. We're going to shrink its size by half. We are going to double the speed at which it's rotating, and we're going to begin to change the color from whatever it was, and I'll usually just go to white. And we're going to keep iterating that until it's smaller and smaller and smaller, until it is a single point of light operating all on its own. And then at that point I say, I'm going to count to 3, and when I do, I'll slap my hands and you're going to slam it right back into where it came from in its new and resourceful way. And amazingly, when we do that, I then distract them and say, think of ice cream or something else. Take a deep breath. Now go back and try and find that pain, and they simply cannot find it. Very simple to do, doesn't require any experience other than just doing it. Always be sure that you make them sure that you're not trying to heal them. If they have an underlying medical problem, they need to have that addressed. This is just temporary emergency help to get them to the next step.